Hello, my name is Morgan. I'll be your nurse today. Before we get started on your physical assessment, is there any questions that you have for me?
No.
All right. I'm going to wash my hands and we'll get started with the back.
Okay.
All right. First, I'm just going to inspect the back. Make sure everything here is symmetrical. All right. And then I'm going to check your APT diameter. So you'll take a deep breath. Let it out. All right. Your AP is less than your transverse diameter. All right, now I'm just going to palpate your back and tell me if you feel any tenderness anywhere, anything hurting.
No.
Okay, now I'm going to palpate for tactile firmitis. So while I'm palpating, if you'll just say 99 or blue moon, okay? I'm going to start now.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and then I'm going to look at your expansion, so if you could just take a few deep breaths. All right. One more. Okay. And now I'm going to percuss all your lung fields. So if you could just take deep breaths while I'm percussing. All right. Okay. No pain or anything?
No.
All right. And I'm going to listen to those same breath sounds that I just percussed. Okay. And I'm just going to have you turn around to the front. All right. And then I counted your breaths per minute while I was doing your lung sounds, and it was 18 beats per minute, breaths per minute. So if you can also take a few deep breaths, I'm just going to see if you're using any of your accessory muscles while you breathe. All right. And you don't seem to be using any accessory muscles. So now I'm just going to palpate the front like I did the back, and you just tell me if you feel anything tender. No tenderness?
No.
Okay. Now I'm going to palpate the tactile firmitis again. So if you could say 99 or blue moon again.
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. And then I'm just going to percuss your lung fields again, a bit in the front. Okay? All while you're taking deep breaths. All right. And now I'm going to check your carotid artery. And I'm going to listen to your carotid artery as well. All right. I'm going to listen. All right. And I don't hear any bruise, but I am going to have you lie down. All right. All right. And now I'm just going to be listening for some certain areas like your aortic area and all that. All right. Aortic area, your pulmonic area, your herbs area, your tricuspid area, and your mitral area. All right. I'm going to inspect now to see if I see any vein distension in either side of the neck. And I don't see any distension. Let me check your chest, the pericardium. And I see no issues there. Now I'm just going to palpate the same areas that I just listened to a minute ago. Aortic area, pulmonic area, herbs point, tricuspid area, and mitral area. Okay, good job. Okay. Now I'm going to listen. So this one more time. Erb's point right there. And then mitral area. Okay. Now I'm just going to take a look in your abdomen real fast. And I'm looking at the contour. It's flat, but there's no lumps, lesions, scars present. All right. Your umbilicus is midline with the rest of your body, but there's no bulging present or anything like that. No visible peristalsis or pulsation found. I'm just going to listen to your bowel sounds. See if I hear any irregular movement. Okay, then I'm going to listen to your vascular sounds. Your aorta, your left renal artery, your iliac artery, and your femoral artery. Okay? Then I'm just going to palpate lightly and deeply on your spleen, your liver, and your kidneys. Okay? So let me know if you feel any tenderness. And then back here to your spleen, and then down here to your kidneys. Okay? Then I'm going to check for Murphy sign, which is for gallbladder. So do you feel any pain? No. Okay? And then next is Blumberg's test. Do you feel any pain whenever I release? No. Okay? So your appendix is good. And then for Rosving sign, if I press here, do you feel any pain over here on the opposite side? No. Okay. We're all done. I had a 27-year-old female in for her physical assessment today. Her respirations were 18 beats per minute, and that was without the use of her accessory muscles. Her anterior posterior was less than the transverse diameter, and her chest expansion was symmetrical with no pain or CVA tenderness on palpation. Her tactile formitis was also symmetric. Her percussion tones were heard over all lung fields with no adventitious breath sounds noted bilaterally. Her carotid pulse was also equal bilaterally, and there were no bruits auscultated over her carotids as well. There was no jugular distension. Her applicable pulse was 70 beats per minute with a regular rate and rhythm. S1 and S2 were heard and were present, but S3 and S4 were not noted. The skin of her abdomen had no scars, no lesions, no lumps, and no tenderness noted per the patient. Also no masses or bulges. But her abdomen was flat and symmetric as well, with her umbilicus being midline with no bulging or masses, no swelling, redness, or tenderness as well. Now, there was no visible peristalsis movement seen, and the percussion did reveal that there was generalized tympany over all four quads. There was no tenderness or guarding in any quadrant with light or deep palpation, so no tenderness to her liver, kidney, or spleen. And her bowel sounds were present in all four quadrants with no hyperactive sounds and no hypoactive sounds. She was negative for Murphy sign, Blumberg sign, and Rosving sign as well.